Guillain-Barre syndrome, GBS1. Understanding the pathophysiology of Guillain-Barre syndrome, GBS. 1. Key concept. An acute autoimmune disorder characterized by the destruction of myelin sheaths and/or axons of peripheral nerves, leading to rapidly progressing muscle weakness and paralysis. 2. Simplified explanation. Think of GBS as an immune attack on the nerves. 2. The body's immune system mistakenly attacks the protective covering, myelin of peripheral nerves, disrupting nerve function. 3. Mnemonic. APARA. For key aspects of GBS. Autoimmune condition, peripheral nerves are attacked, ascending paralysis or weakness, rapidly progressing symptoms, acute onset. 4. Key features. Autoimmune response. The body's immune system mistakenly targets and attacks the myelin sheath, demyelination, or the axons of the peripheral nerves. Peripheral nerve involvement. Affects the nerves outside the brain and spinal cord. Demyelination and axonal damage. The immune attack can damage the myelin sheath, insulation around nerves, or the axon itself, disrupting nerve signal transmission. Ascending paralysis. Muscle weakness and paralysis typically start in the legs and ascend, progress, towards the trunk and arms. Rapid progression. Symptoms develop quickly over days or weeks. 5. Main triggers. Infections. Usually follows a bacterial or viral infection, for example Campylobacter jejuni, cytomegalovirus, CMV, Epstein-Barr virus, EBV, Mycoplasma pneumonia, or Zika virus. Vaccinations. Rarely it can be triggered by vaccinations. Surgery or trauma can be a trigger in some cases. Autoimmune diseases may also trigger GBS. Unknown cause in some cases, no identified cause. Clinical manifestations of Guillain-Barre syndrome, GBS. 1. Key idea. Symptoms are characterized by rapidly progressive muscle weakness and sensory changes. 2. Mnemonic for GBS symptoms, paralysis, paresthesias and numbness of the hands and feet. Ascending symmetrical muscle weakness, starts in lower limbs, progressing upward. Reflexes reduced or absent, hyporeflexia or areflexia. Ataxia, impaired balance or coordination. Lethargy or fatigue. You may have difficulty with facial expressions, chewing, or swallowing. Sensory changes such as loss of touch, temperature, or pain sensation. Inability to perform ADLs such as walking, dressing, or eating. Sometimes respiratory muscle paralysis, difficulty breathing. 3. Specific symptoms. Symmetrical weakness. Affects both sides of the body equally. Muscle weakness starts in the lower extremities and progresses upward. Sensory changes, numbness, tingling, or pain. Cranial nerve involvement. Can cause facial weakness, swallowing difficulty, and visual problems. Autonomic dysfunction. Irregular heart rhythms, changes in blood pressure, and bladder, bowel problems. 4. Important note. Symptoms can progress quickly and in severe cases can lead to respiratory failure. 3. Diagnosis of Guillain-Barre syndrome, GBS. 1. Key idea. Diagnosis involves clinical evaluation and specific diagnostic tests. 2. Mnemonic for diagnosis, CL. Clinical evaluation and history, detailed history, physical exam and symptoms. Electrophysiological studies, nerve conduction studies, NCS, and electromyography, EMG. Helps identify nerve damage and distinguish between demyelinating and axonal forms of GBS. Lumbar puncture, cerebrospinal fluid, CSF analysis. Often shows elevated protein levels but normal cell count, albuminocytologic dissociation. 3. Additional testing. Blood tests to evaluate for infections or autoimmune markers. IV. Management of Guillain-Barre syndrome, GBS. 1. Key idea. Treatment focuses on reducing the severity and duration of the immune attack, preventing complications and supportive care. 2. Mnemonic for treatment, PERC. Plasma exchange, plasmapheresis, removes harmful antibodies from the blood. Intravenous immunoglobulin, IVIG. A solution of antibodies from healthy donors that helps to suppress the immune system and limit the attack on nerve cells. Respiratory support. Mechanical ventilation may be needed for patients with severe respiratory muscle weakness or failure. Complication management with supportive care to manage pain, prevent blood clots and infections. 3. Additional treatments. Pain control with medications. Physical therapy and rehabilitation to recover muscle strength and mobility. Occupational therapy. Speech therapy if swallowing is impacted. Monitor autonomic dysfunction and treat as needed. Nutritional support and ensure proper hydration. V. Potential complications of Guillain-Barre syndrome, GBS. 1. Mnemonic. Reels. Respiratory failure, due to paralysis of the respiratory muscles, which is a life-threatening complication. Electrolyte imbalance or autonomic dysfunction, such as cardiac arrhythmias and blood pressure irregularities. Aspiration pneumonia, if the patient has difficulty swallowing. Long-term neurological problems, persistent weakness, fatigue, and other neurological deficits. Sepsis or other infections. 2. Additional complications. Deep vein thrombosis and pulmonary embolism. Muscle atrophy. Pain, anxiety, and depression. Permanent disability. Simplified explanation. 1. Immune system attack. The body's immune system attacks and damages the nerves outside the brain and spinal cord. 2. Myelin and axon. Damage. The protective myelin sheath is destroyed and/or axons are damaged, which affects signal transmission. 3. Ascending weakness paralysis. Symptoms start in the legs and move upward, which may progress to a total body paralysis. 4. Severe condition. Severe symptoms can impact breathing and other key functions. 5. Multiple treatments may require plasma exchange or IVIG. Professor Hammer's advice for learning GBS. 1. Think autoimmune. The immune system is attacking the body's peripheral nerves. 2. Understand demyelination. It's the destruction of myelin that disrupts nerve function. 3. Ascending paralysis. Remember the key symptom, progressive weakness moving upward. 4. Understand the tests. Nerve conduction studies and lumbar puncture are key diagnostic tools. 5. Remember the treatments. Plasma exchange and IVIG are used to help stop or limit the immune attack. 6. Focus on complications. Know that respiratory failure and cardiac arrhythmias can be life-threatening. In summary, Guillain-Barre syndrome, GBS, is an acute autoimmune disorder characterized by demyelination and/or axonal damage in peripheral nerves, resulting in rapidly progressing muscle weakness that may progress to paralysis. Understanding the underlying pathophysiology, recognizing the clinical symptoms, and applying the appropriate treatments are key to managing patients with GBS.